it's out. Yesterday, the plant in Kalamazoo started shipping it around the country, and airplanes are taking it around. And it's a really exciting time. And I feel like, you can't overemphasize how much this is like the beginning of the end. We still have a long ways to go, and it's going to be a long time before we get doses out to everybody. But I know nurses at our local hospitals that are getting vaccinated for coronavirus today. And so I think that's pretty amazing. And I kind of wanted to talk through some of the common things that I'm hearing, some of the things that last week when I did some videos on it, we just didn't have clarity on, but now we do. And so I wanted to talk to you through those things. First and foremost, I wanted to reflect back and show here where we're at, which is really a tough spot. And for the people that are thinking, well, things are better because I'm not seeing it as much or I'm not hearing about it as much and we can do our normal stuff for the holidays, we're at the worst point by far in the pandemic that we've ever been on. So if in the past you did like held back on doing things that you normally did because you were worried, now would be the time to be more worried about spread. Not only because it's the case count is just out of control, and if you look at this graph, you can see how many daily cases that we're having, how many hospitalizations we're having, but we're tapping a lot of hospitals to their point of not having more beds available and not being able to provide that care. And we're coming up on a time where people travel, and we already know that a lot of people traveled over the Thanksgiving holiday, and we're seeing case counts rising from that. And now we're seeing that despite that, we're likely going to have a lot of travel over the Christmas holidays too. And I totally get it and I understand, and I want to celebrate with my family and my wife's family and all the people that we know and love and in years past have spent lots of time with and enjoyed the holidays with. But right now, I think it's just going to be the year of the year of staying at home. And it's really for everybody's benefit because if I get COVID, well, I already had COVID, but I didn't have a severe case. There was a very low chance that I would have a severe case where I needed to be in the hospital. And likely for you, it's a low likelihood of that. But what we know is we're around other people, and we can't just cloister the vulnerable people and keep them out of society and expect that that will be okay. That's why our hospitals are so overrun and at capacity, is because we already have proven we can't do those things. And we've also proven that we can't lock down successfully either, and that it's caused just a lot of divicity, is that a word? Divisiveness, and all the other things that go along with it. And so what we need to do is kind of just say, we can see the light at the end of the tunnel. It is not here yet. We are not there yet. And all we need to do is stay put for a little bit longer until we can get vaccine out to enough people that we can protect society and protect those that are at risk, because the number of deaths is already approaching 300,000. And that's a lot of people lost. That's a lot of family members affected. And I'm sure by now the majority of us know somebody that has been hospitalized or that has died from coronavirus. And we know that things are still rising right now. And the case counts, as they continue to go up, you have to remember that if the case count is, what it is, as you see on this graph right now, those are the people that are going to be hospitalized. Some of those people are going to be the ones that are hospitalized on top of what we already have hospitalized in a week and a half to 2 weeks from now. And then those are the ones that, as we go into Christmas and it is almost Christmas. Christmas is really close. As we go into New Year's, those are the ones that are dying from it. Those that are popping up now as infected are not going to be dying for several more weeks. So we know that even if we start to have the case count receding, it's going to be several more weeks before hospitalizations and deaths turn for the better. And so we still have some work to do to get there. Now we have the vaccine, and the vaccine is coming. And so that's what I wanted to talk about today. I also wanted to share the toll that it's taking. This was interesting. Half of parents working from home say it's been difficult for them to work without interruptions. And I don't really understand how it's only half. I honestly don't know how it's not even more. So parent of a child less than 18, 50%. Parent of a child, not parent of a child less than 18% difficulty working from home without interruptions. I feel like that underrepresents at least what I would imagine most parents. And maybe comment yes below if you've had to do some telework and that it's been difficult to not have interruptions, because I think, at least in my view, that it must be a lot more than just 50%. It's like 99%. So there's a lot of questions about the coronavirus vaccine, and what I talked on a previous video, which you can go back and watch after you're done with this one, if you want to know about the mechanism of action and how that actually works. And I did, these really nice diagrams that are in my recycle bin here of, DNA to mRNA to protein and how that makes a spike protein and it gets recognized by the immune system and creates antibodies. What we're going to talk about today, see, there's the central dogma too. You, I'm sure, remember this because you took loads of notes and everything like that. What we're going to talk about today is some of the side effects and things that we have more information on now and what to expect. So I took this from a really nicely put together kind of resource that has all the information. I'll try and link below to that, but I took some notes on here and or highlighted some things. Can I go back to my pre-COVID lifestyle after I get the vaccine? So yes, but not right away. The reason for that is we don't know yet. They haven't done the studies yet to determine, does getting the vaccine prevent spread or does it only prevent disease? Now we know, assuming that the vaccine works for you, that you develop antibodies that prevent you from getting the disease, which means that once if you're exposed to COVID, your antibodies will detect that, destroy the virus, and you won't get the symptoms and severe illness from it. What we don't know yet is, because there just doesn't have enough time to study it yet, we don't know if you get COVID and it starts replicating, it starts growing before your immune system kicks in to destroy it, can, during that time period, which might be a couple days or something like that, where it's building up in your system to the point where your body recognizes it, starts fighting it off and destroys it, could you have enough viral replication, viral copying going on that you could spread that through respiratory droplets before you are before your body fights it off or before you get sick? We know about asymptomatic spread, which is pretty unique for this virus and how long it goes. And so we know that there's the chance of that. So that's something that they're still kind of trying to figure out, which means that we can't right away just, get our shot, throw our mask in the trash can and go about life as usual and go to pool parties. And I don't even know what people do for fun anymore. Football game, tailgating and stuff. And so it's also going to be really difficult to know who got the vaccine and who didn't. Well, there's not going to be any sort of like tracking system as far as I have read or that anything has been, shared that people are going to know who's been vaccinated and are we getting together with people that have been vaccinated. We're not going to have any sort of way to monitor that. So we kind of have to wait until there's enough population that has it that we start to see case counts drop, and that's going to be a local thing too, of seeing case counts drop. I've said over and over on all my videos how this is all local, and that's going to be the case. Like some places will get coronavirus vaccines sooner, some will have access to it because they have cold storage, and some rural areas won't have access to it as early because they don't have those things. There's going to be a lag time. So, and it also of course takes time for it to start working. The thought is 10 days from when the vaccine that you get it from the first dose, you'll have some level of antibody protection. After the second dose, which you get 2 to 3 weeks after the first dose, then it's like a much higher level. And we'll talk about that in another moment. Okay. Next question is like, what are the common symptoms? So after you get the vaccine, first and foremost, as we talked about with the way that this all works, getting back into my recycling bin here, there's no coronavirus in the coronavirus vaccine, which means it's impossible to get coronavirus infection from the vaccine. You only get one small snippet of one piece of messenger RNA that encodes the spike protein. That is what the antibodies are going to bind to when you actually get exposed to coronavirus and infected with it. So there's no way to get coronavirus disease from the vaccine. The vaccine I actually have here, I'll show you the, messing them all up here. The active ingredients. So the active ingredient is the messenger RNA. And then there's fats in it too. The fat is like a little molecule that goes around that messenger RNA. Messenger RNA is rapidly and easily degraded. And so the fat around that protects it so that it can get into the cell. And then there's just some really simple salts. This is the stuff that's in all the food that you eat. And some sugar too. So if you're keto, watch out, 6 milligrams. Doesn't even count. But there's no actual coronavirus in there. There's just messenger RNA that encodes for one protein out of the, I think there's at least 20 or 40 or 60, I could be totally wrong, proteins that make up coronavirus itself. So there's only one of those in there. So there's no actual coronavirus in there. So you can't get it, but you can get some symptoms. And that's related to your body responding to what it has, perceived as a threat. Okay, most people experience mild reactions, if any, from the Moderna vaccine. About 2% developed high fever, 102 to 104, and chills. Moderna vaccines, fatigue, and 10% muscle pain, and 9%, 5% joint pain, 5% headache. So, in terms of vaccines, that's pretty par for the course in terms of all the vaccines that we get and give on a regular basis. Um, oops. With the Pfizer vaccine, younger participants they had more symptoms, which is typical because you have a more robust immune response. Fatigue, headache, muscle pain, chills, joint pain, and fever. They actually studied this in adolescents, and 14% had fever, 20% after the second dose had fever, and in older adults, 1% those that received Pfizer vaccine had fever after the first dose, and 11% after the second dose. Which the thought is, your body is already partially recognizing it, and so the second dose is really a booster dose. So you would expect that the body that has already been primed for it is going to be more quick to jump on that and have that inflammatory cascade that results in fever, that results in fatigue, and those sorts of things. There were no serious side effects in either the Pfizer or Moderna trials. Let's see. Like I said already, the response was stronger after the second dose than the first, and it was mostly fever, headache, fatigue, those sorts of things. Probably, and as it says down here that I circled, the reason that the vaccine efficacy jumps from 52 after the first dose to 95% after the second dose indicates that there's a stronger immune response to the second dose, which is why you kind of feel crummier for a day or two. Nothing like getting coronavirus, nothing like getting hospitalized, put on a ventilator, anything like that from coronavirus. We're talking stuff that would maybe stop you from going to work for a day, versus being in the hospital or having a loved one seriously ill because of coronavirus. So certainly in terms of the symptoms, the benefits outweigh the drawbacks from it. Okay, is the vaccine safe for children? We don't know yet. Sorry, I'm making this thing go all over the place. They started testing it in kids down to age 12, and they're going to test it in teenagers for Moderna, but we just don't have that information yet, so we're not going to give it to teens yet because of that. We're not going to give it to young kids yet because of that, because we just don't have the data. And that's typically how vaccine trials go, is like you give it to the larger part of the population, adults first, children get it second, and then we go from there. So it's going to take a little bit of time. I imagine that as things ramp up in distributing it to adults, that they'll quickly move on to giving it to younger and younger children, so we can see, what about the teens? What about the adolescents? What about the school-age children? Then what about the preschoolers? And what about the babies and everything like that? Working our way down in terms of age. Can someone who gets vaccinated against COVID-19 still transmit the disease to someone else? That's what we're not sure about. That's why I said, you still have to wear your mask and do the distancing and stuff until we know what the status is, until a large portion of the population has it. It's just going to take some time to get to the point where we know, can you still transmit the disease to somebody else? We're not 100% sure on that yet. And so it'll take a little bit more time to get there. Will a COVID vaccine offer better immunity than infection? So interestingly, there were higher concentrations of neutralizing antibodies in people who had the vaccines than who actually recovered from COVID-19. I had COVID-19, as you might know. And so I likely have antibodies. I've never tested it, although I've been tempted to test it from time to time just to see if those would show up. But getting the vaccine gives you higher neutralizing antibody titers, meaning that you're more likely to have the antibodies circulating in your blood that will fight off and in the vaccine, in the infection, if you're to get the Pfizer or Moderna vaccine, than just to go through it naturally. So I think that's interesting and reinforces that even people that have got coronavirus in the past should get the vaccine, and you don't have to do testing, you don't have to do titers or anything like that before you get it. The recommendation is that everybody, regardless of past experience with coronavirus, get the vaccine, even if you've had COVID and recovered from it. If you're in the acute phase of having coronavirus, you're supposed to wait at least, I think, 10 or 14 days. You'll have to check with your doctor to know exactly the timing. But if you have coronavirus right now, you can't get the vaccine until at least like 10 to 14 days after you've gotten over it. But anybody that had it, a month ago or 6 months ago or something like that can and should get the vaccine, irregardless of if you already have antibodies or anything like that. Let's see. Oh, this was a question about, does it integrate into your DNA, which I've talked about on previous ones, that no, it doesn't. mRNA is the molecule that the vaccine has in it. It stays in the cytoplasm of the cell. It doesn't go into the holy of holiest, the nucleus, where the DNA is kept. It stays in the cytoplasm. It takes that mRNA and it makes it into protein that makes the spike protein. It doesn't get into the DNA. There isn't a mechanism for it to just like integrate itself into the DNA and affect the rest of your cells in your body or anything like that. That one has been explained by me and many others many times. Should I already get the vaccine if I've had it, COVID? Yes. Since we don't know how long natural immunity works, then the recommendation is yes, you do. Pregnancy. Can I get the vaccine if I'm pregnant? So this is a question that is still unclear. Now, what we know is that pregnant women are at risk for more significant coronavirus illness, which makes them a category of people that we should find out as quickly as possible. Is it safe to give them the vaccine? Because if we can get them the vaccine and prevent them from getting coronavirus, we're going to improve morbidity and mortality overall, because vulnerable populations are protected, just like those in nursing homes and the elderly and those with diabetes and all the other things that put you at higher risk. Pregnancy is one of those categories that puts you at higher risk. The American College of Gynecology and Obstetrics, the Maternal Fetal Medicine Society have said that it is okay by them to get that vaccine because they believe that the risks of getting coronavirus outweigh the benefits to waiting and finding out is it safe, because from a mechanistic standpoint, from a biologic standpoint, from the research that we have, it appears to be safe. Now, we don't know this definitively, which is why everything like this is talk with your doctor, make an informed consent, informed decision based on personal risk factors, personal preferences, disease burden in your community. All of those things play a role in determining that. So I am grateful that the American College of Obstetrics and Gynecology and the Maternal Fetal Medicine and others have said, and the ACIP have said, it is okay for pregnant women and breastfeeding women as well to get the coronavirus vaccine. There wasn't a ban on it or a mandate that they not receive it, because we know that if we can have those discussions, if we can make those decisions with the informed consent, with the understanding that there's nothing without risk, including doing nothing has risk, doing something has risk, that we can balance those things and make the right decision based on personal preferences, personal values, and case counts in the community and things like that. So all that is to say is that locally, as far as I know, and I've talked with a few different obstetricians and gynecologists and others, is that it looks like the recommendation will be talk with your doctor, but feel comfortable in making that decision if that's what's right for you. Same with breastfeeding women. From a mechanistic standpoint, if I'm a mom that's breastfeeding and I get the coronavirus vaccine and then I create antibodies, those antibodies will be in my blood. Perhaps they'll be in the breast milk that then gets to baby. But if any of the mRNA were to get into the breast milk, which I don't think that there's a mechanistic idea or biological idea that would be the case, then the breast milk would go into baby's digestive system, the stomach acids and everything would break that down and destroy it, and there wouldn't be any detriment to the baby if they were exposed to that. The same thought in the womb is that passive antibodies may get from mom, that are created in mom by mom's immune system, to baby and provide some level of protection. So I think what we're going to find from everybody is, yes, talk with your doctor, make an informed consent decision, but feel comfortable with making that decision, especially if you're a healthcare worker, especially if you're on the front lines and are pregnant or breastfeeding and are at risk for coronavirus illness. That is certainly a stronger suggestion that it might be worthwhile to consider that and go forward with that, knowing that we don't know everything, but that the risks are likely outweighed by the benefits. Hope that makes sense. Can I get the vaccine if I'm pregnant? Same sort of thing. Most current vaccines are given to pregnant women. Most of them are non-live, meaning the only live vaccines that we really have are measles, mumps, rubella, and the flu mist spray, and probably one other that's escaping me right now. But we give all those other ones, non-live ones, to pregnant women because we know that it protects them from illness, which protects their baby, because if mom is sick, then it's hard for baby to grow and develop normally. And also, at the same time, knowing that those antibodies that mom makes can get passed through the placenta and through breast milk to baby and provide protection to baby. So we know that vaccination in general is very good for pregnant women and for new babies and breastfeeding moms to prevent illness and to prevent or to increase the spread of disease immunity through those antibodies sharing between mom and baby. That was a lot. I need a drink of water. I'm going to end here for today and talk more about vaccines on the next time. If you have questions, comment below. If you're watching on YouTube, hit subscribe, hit the bell so you get notified when I go live next time. And please share this, because I think this is important information, especially the breastfeeding and pregnancy stuff that isn't very clear to a lot of people. And it's helpful to have a little bit of clarity as we go into this new week and this new exciting time. It has been really hard for everybody. It is not over yet. But there is some hope to be had now, some more hope than has been before with the pandemic, because we know that there's a light at the end of the tunnel and the vaccine will be available and it is quite effective. I hope you have hope and can take that and move forward knowing that things will get better soon. Keep up the good work. And like I said, comment below if you have another question, because I like doing these and answering your questions. And if you have a question, you can also text me. It's 402-256-0768 to text me, and I will try and answer those questions as well. Keep up the